Hi, everybody. My name is Des Byrne. I'm one of the co-founders of Refill Assistant. Welcome to our webinar. Thank you for attending. So I'll just give it a couple of more seconds before I start, as quite a few people had signed up. I am anxious though to get finished before 9 o'clock, so I set a timer on for 15 minutes as we go through this. The way I would like to do it, if possible, there is a Q&A panel at the bottom on Zoom. And if you just put in your questions in there, type them in, I'll answer them at the end. If I don't get to answer them at the end, I will email you separately. So again, thank you everybody for attending, much appreciated. It's a little bit early. I want to finish by 9 o'clock so that we get everybody up and running with opening the pharmacy at 9 a.m. So this webinar is about the lessons that were learned from the 2020-21 flu season. The IPU had asked us to develop a piece of software around vaccination bookings and scheduling for in advance of that flu season. We did so, released it in August, and yeah, what a season to actually release a piece of software. It was a really difficult season for everybody who was involved in it, and we learned a ton of stuff. And the first part of this webinar is about what we learned and what customers told us on feedback. And the second part of it is about the changes that we made to the pharmacy services booking engine in anticipation of COVID-19 vaccinations. So I think the main characteristic of last year's or the 2021 flu season was there was a significant supply and demand imbalance. It was caused for a variety of different reasons. But demand was enormous, supply was constrained, and that was an imbalance. And normally there's safety valves under those circumstances. Prices will go up, which to subdue demand, or lead times increase. And again, I've experienced lead times going from 6 weeks to 16 weeks in a production environment, and it's not unusual when there's a significant supply and demand imbalance. But those safety valves weren't there this time around, because essentially the vaccine was free for an awful lot of people, and just people wanted now. And there were definitely supply problems. And it wasn't a price issue; it was just that there was supply coming into the country. And what that meant, and the consequence of that, was deliveries were basically on allocation. And allocated deliveries means that people are getting partials, are getting delays. There's constant pull-ins, push-outs, and it's defined by shortages. So you never fully get what you'd ordered. If you'd ordered 100, you got 50, or you ordered 40, you might have got 10. It really depended, and that really made it very difficult to manage vaccinations. What we found in a lot of our customers, like, tons of things had to be rescheduled, and it was constant and ongoing, certainly for the first 4 to 8 weeks. Consequently, the workload in the pharmacy was enormous. A lot of phone calls, patients calling in, asking questions, you having to call out, rescheduling stuff. And consequently, there was dissatisfaction across the board with patients, with staff, and it was really difficult season. And like, we felt the pain, and indeed we had to live the pain too, because we had to support our customers through that period of time. Now, here are some of the observations that we saw during the flu season, and they were in the context of us putting a online booking engine to work for our customers. And so a couple of things that were very evident right from the start: demand was extremely strong. Like, right out of the box, there was huge demand for the flu vaccine, and that sort of took us a little bit by surprise. Other things that we observed that were things like there were multiple people trying to book the same appointment slot. So you could have two people fighting over the same appointment slot, and that was going on, and we could observe that in our software. And even in extreme cases, all appointments got booked out within 20 minutes. That means 2 weeks worth of vaccinations were booked out in a 20-minute slot, 20 minutes duration. It was really extreme, and it happened in a couple of cases, but it did happen. And we sort of internally said, God, that looks like Ticketmaster. It's a Ticketmaster effect. Who would have thought? But it did happen. And we think that there's likelihood for that to happen as well for now, for this COVID vaccinations. So as a consequence of how this worked, then, elderly people, those with a disability, or maybe those with a limited internet access, definitely were disadvantaged with a fully automated system. They weren't up on time, they weren't quick enough off to make the booking, etc. And it definitely didn't work for that cohort of people and that was a problem for them. As we went through the flu season, we found our customers were using the medical history, and they were using it increasingly. It was increasingly being used as we went through the flu season, and they were adding to it and adding new questions. And it was all the time they were looking to qualify better the people who were requesting a flu vaccination as the supply was constrained. We observed from across our customer base that a single appointment list worked best. There were people who were running multiple appointment lists and were running an online system, and it really caused them a lot of difficulties, a huge amount of difficulties. And anybody who used an online system like ours, once they got into it and once they got a supply of vaccine, I mean, it worked really, really well. They were running 6 shots an hour in a one-room environment, one consultation room environment, with space, of course, for people coming in and for them leaving and to be observed for 15 minutes. And there were really people were, because they had all the questions reviewed, etc. They were down to a 60 to 90-second flu shot, so it was really, really efficient when it was fully scheduled. And one of the things that surprises was, typically a pharmacy website is low traffic. Community pharmacy traffic is quite low, but we found with the booking engine that the traffic was high onto the sites, and abandonment rates were low, which means that for every 10 people that went onto the site, 9 were booking an appointment. So that would surprise us a little bit, but it's good, and I think it's a function of the fact that pharmacies are highly trusted within the communities that they serve. And I think the website is an extension of that. So the traffic was high and the abandonment rates were low. So, pulling all that together, and then we did interviews with some of our customers afterwards, and we wrote down pretty much everything that was said to us about what happened during the flu season. And we pulled together some lessons around, what they were saying to us around what what the HSE calls the mass ramp up phase. And I think the mass ramp up phase is a phase that we're just about getting into now for the flu vaccination. So, there's going to be delivery starting to open up. They're going to move past the at-risk, 1 to 8 groups, and we're going to move into this mass ramp up phase, and that's where pharmacies are going to be involved. I think the first lesson to be learned is that initially, definitely assume the vaccines are on allocation. And assume that there will be shortages. And I think if you go with that one point in your head, then everything else will be much easier. And plan accordingly. There will be allocations, there will be shortages, and there will be delays. So that's the first thing. Second thing is that enable patients to register on a wait list. Don't open up a booking system automatically from the get-go. It'll cause too much heartache. But do facilitate patients and do enable them to register on a wait list. And whatever you do, one of the things that we observed last year was that there were multiple lists in the pharmacy. So whatever you do, put everything in a single system on a single list. And it could be paper and pen, it could be Excel, it could be online, be whatever you want it to be, but just do it religiously in one place. And no matter what happens, whether it's a walk-in appointment, a phone call appointment, an online registration, put it all into this single system. So you've got a single source to manage everything effectively. That was definitely a lesson learned, and definitely last year we saw people, consolidating lists, but it was into the flu season. It was getting late, and we definitely saw that happening. One thing that we think would be very useful is to obtain and check medical history in advance. That will help you prioritize. Again, last year we saw people using it increasingly. They're adding questions to it as we went through the flu season. But if you have the medical questionnaire answered, then and you have it reviewed in advance, it will really help you with your prioritization of anybody who is registered. The registration waitlist, it can be used for 2 things. I think one is prioritization, as I outlined, and the other is contingency planning. So the HSE is asking that people have a contingency list. It makes sense. So these are effectively people that can arrive within 10 minutes to the pharmacy should you have a shot available. So use that registration list for that. When scheduling vaccinations, obviously your call, but certainly initially schedule them a vaccination on the on receipt of the vaccines, or failing that, then you're 100% convinced that you're going to get your full allocation of your order. So only then schedule your vaccinations. Don't let people schedule until that is until they're in the fridge. Effectively, someone described it to me that way recently, and I thought, yeah, that makes a lot of sense. If you're using an online calendaring system, so it just does calendar bookings and scheduling, then ensure the number of appointment slots that are available to be booked are less than or equal to the number of vaccines that you expect to get. Really, really important. Anybody who used our system last year, before we optimized it for registration wait lists, they were able to nail it just on this one point alone. They ensured that the number of appointment slots were less than the number of vaccines. So very, very important thing. So as we move out of the ramp up phase, the HSE, it has this plan that I've highlighted on the screen here. We're going to move into the open access phase. The open access phase is when they expect a larger number of doses to be available. There may be other vaccine types. We will have gone through, large numbers of people. That would be open access phase. We're probably right now in the early stages of mass ramp up, just exiting initial rollout with the at-risk groups, and getting into this mass ramp up phase. I think as we transition from the mass ramp up phase into open access, there will be different requirements of a system, no doubt. The open access phase is likely to be defined a little bit by vaccine hesitancy. Certainly, as we go further into the open access phase, that will definitely be the case. And that's a place where I think pharmacies can play an exceptional role. So one thing to think about the open access phase is operational efficiency. And indeed it is for both, of course, but anybody who used our booking system last year and really had it sorted, they had a proper workflow built around it. I mean, they had the operational efficiency nailed. They were doing 6 vaccinations an hour. And in effect, what they were doing was, if they're getting a delivery of 40 vaccinations a week, they weren't leaving their schedule open for 40 hours every week, 9 to 5, for 5-6 days a week. That was not the schedule that they made available to patients. The schedule was actually 2 hours one morning and 2 hours one afternoon, and that was 4 hours of work. And that's how they were delivering their shots. So if they got 40, they were planning it that way. They had X number of hours that they would make the vaccination system available to patients for a booking, and that was it. They weren't making it they weren't making all hours available for a booking. So operational efficiency is really key. It's going to be really important anyway to get the productivity up on this. But as you go through it, as you go through the season, that is one thing to look out for. And I think the other side of it is, as we get into the open access phase, is this vaccine hesitancy. I mean, there are a couple of criteria that the World Health Organization have. They have there's a model that the World Health Organization have around vaccine hesitancy, and 2 of the main items in their model are confidence and convenience. And I think that's somewhere that pharmacy can really play a role. And it's something that we observed last year in the booking engine. There was high traffic to pharmacy websites. A little bit surprised in it, but in hindsight, it wasn't, because patients have a high degree of confidence in their pharmacist and in their pharmacy. And indeed, I saw something come out from on LinkedIn the other day from Dara O'Loughlin from the IPU, which was saying that, it's the #1 trusted profession in Ireland, which is great. So that confidence side is going to come into play as we get into vaccine hesitancy. And one thing to think about in terms of booking engines and so on is that, you don't necessarily want people to move off your website. You want them to stay there. You want them, when they're making a booking, they're on your website. They're not, going off to a third-party tool and booking there, and all of a sudden they're thinking, oh, where am I? No, you want them to stay on your website, and that'll build that confidence and help. And the other side of it then is convenience. And again, as we get into further into this open access phase, and convenience becomes, one of the factors that are really important to get more and more people vaccinated, then, a pharmacy is the most convenient medical resource that most patients have. And again, to back that up in terms of a booking service, if you have it on your website and it's fully automated, that makes it very convenient for the patient. So they're the sort of lessons that we had learned from that flu season. So hopefully I'm less than 15 minutes into this, which I am. So I'll just finish off my timer there 1 second. And then I'm going to talk to you a little bit about the vaccination booking software that we built to take account of these lessons. So the IPU last year commissioned us to build this software. It was for the flu season. We deployed it during the flu season. Quite a few customers in Ireland use it. And of course, we spent the whole back end of the summer, all of the autumn, supporting our customers because they were having such a difficult time. So we learned a lot. We made a lot of developments on the tool as we were working through it, but we learned a ton of information, and we've put that into this COVID-19 vaccination software. And thankfully, we sort of viewed it as a dry run. And we interviewed everybody, asked for the words, we got all their feedback, and we put it into the software. So I'm going to talk about that a little bit and tell you just a little bit about what that is. So basically, it is COVID vaccination software. It does allow you to put in place a much more efficient and effective vaccination program into the pharmacy. It allows you to have a single resource for everything. So let me just talk about a couple of different modes of operation. One of the biggest things that we did for COVID-19 was we put in place a waitlist mode. And basically what a waitlist mode does, it allows a patient to either register themselves on a waitlist or allows the pharmacist to register them on their behalf. Okay, and we've also added some prioritization tools, which will facilitate prioritization and contingency planning. And really, this waitlist mode is there for when there is a strong mismatch in supply and demand. And it's very easy to switch it on and off. The whole system can be switched on and off, for waitlist mode, as can a patient. And then we have a scheduling mode, and the scheduling mode was, what was available for flu vaccinations last year. This is for confirmed bookings. It has a confirmation reminder workflow associated with it, with SMS texts and emails. And it also facilitates second and or third booster shot appointments as well. So there's two modes. There's a waitlist mode and there's a scheduling mode associated with the software. And you can switch them on and off on your website, and equally you can, if something happens that patient is scheduled and you need to move them back to waitlist road for whatever reason, then you can do that. And it's easy to move just with literally a press of a button to move somebody off your waitlist into a scheduled appointment. And we have some workflows and trainings around that topic as well. So that's the first thing. Second thing is there are two ways to get data into the system. One, it's a self-service mode. It's a button on your website. It's an image on your website. It's whatever you want it to be. So book COVID-19 vaccination. So that's a self-service mode for patient. It's installed on your website. It's really easy to do. And it's once you do it with a self-service mode, you get everything from the patient. You're able to communicate to them the value proposition and information about the vaccine, and they must okay that. You're able to get their contact details. They're able to insert all of that, including their PPSN, mobile number, email address, etc. You're able to obtain answers to the medical questions that you've defined for the vaccination service, and you're able to record the vaccination consent. So that'll all be done. And that'll all be done whether it's the appointment is set up as a scheduled appointment or whether it's set up in registration waitlist mode. Doesn't matter. You'll have all of that information. And the other way of getting data into the system is the pharmacist enters the details in. So you could have walk-ins, phone call appointments. You could go through your PMR looking for priority patients and just enter all those details into the system. So that means you've got one place for online appointments, walk-ins, phone calls, and then your analysis out of your PMR. It's all in one place. So they're the two sort of main items around the two main sort of features, or the two main structures that we've put in place to support COVID-19 vaccinations. But in addition to that, then there are other things that are available. So contact details, PPSN, recording medical information obtaining vaccination consent, scheduling second, third booster shot vaccinations associated with the first. So it's not separate too, it's associated with it. Switching between waitlist and scheduling. So putting either switching the mode for people on a self-service or switching the individual patient between a waitlist and scheduled appointment and vice versa. There's a facility to export appointments to a CSV file, which can be opened in Excel to support your data entry with the HSE systems. There is configurable content, so everything is configurable. All of the information content can be configured, all the questions can be configured, the consent can be configured. We'll have default, and we do have a straw man on that now, on what the default is. And as we get further down the road towards the end of this month, it'll probably tighten up and we'll get better guidance on that. But so we do have configurable content. It supports external clinics. So if you've got, a one room in the pharmacy and you have another one next door, we can actually set up two rooms for you. So it supports external clinics. It supports like company clinics. So if you've got a flu vaccination service with companies, then it supports that. We handle it in a slightly different way. It's still self-service, but we basically disable all of the SMS texts and the message, the emails, and there's no scheduling. Then you just go to the company at 2 o'clock on Sunday afternoon and just line everybody up between 2 and 4. You do the vaccinations. It supports multiple locations, so if you have several pharmacies, it supports multiple locations, and each location has its own sort of control panel for the vaccinations, and it works in your existing website. We've pretty much last year we did it on, Shopify, Joomla, WordPress, AB Commerce. It supports all of those different websites, so we're pretty confident it'll work on everything, and it's very simple to install. For a developer, it should only take a handful of minutes. I mean, on our customer websites, it takes me about 5 minutes to do it, and that's it. And I'm not a web developer. So they're the key features of the product. I'm going to then now go in and just show you some of this as we're going through it, and show it to you in real time. Conscious that it's just past 10 to 9, but I'll show you this really quickly. Two sides. One is the pharmacy side. So the pharmacy side, this is your portal, the pharmacy portal. This is the control panel for all the appointments. This is where everything comes in. This is where you manage all the patient appointments. I've got some of them that I've done yesterday. I've scheduled some appointments here. You can see that they're scheduled for Tuesday next week. Here's one at 2 o'clock and so on and so forth. And I've got 4 on a wait list. So these people were put on a wait list. Again, I just put 4 in just for myself, so you could see that. And I'm going to show you how that works. On the patient side, then literally they go to your website and they can just press book COVID-19 vaccination. In this case, I've got a different button name. It's going to bring up the vaccination name. In this case, it's the first vaccination of COVID-19, and it's the AstraZeneca one for over 65s. All of this is configurable. It can say whatever you want. The title, subtitle can be whatever you want it to be. So just they click that, and the information gets presented to them as to who should get vaccinated and the details behind it. So we have new content for this. It's much more comprehensive than what's in this one, but it's a description basically. And before they're allowed to progress to the next step, they must say that they've read and understand the above information. Next step then is, in this case, I've set the appointment up as a registration for a wait list. So they must register. So they click registration. We're going to put in my name, patient Des Byrne 5, just so you see that coming up. Put in my PPS number. That's a mandatory field. I'm going to put my mobile number. In this case, I've just set it up for mobile numbers and not emails. 0. And then I must mark the GDPR consent, so I agree to be contacted about the appointment. Next is I'm asked to do the medical history and enter details on that. I've only just put 4 questions in here just to be quick. Are you over 65? No. List any allergies you have. Pollen. Next, list any medications you're on. They can skip these questions if they want to. List any conditions that you have. Again, they can skip it, and I'll show you that in a minute how to deal with that. Next piece of the consent. So in order to register on the waitlist, they must read through this and they must click on this. I understand and consent to the above. Again, this can be configured. We changed that line last year to I understand, consent to the above, and we wear loose-fitting clothes and not bring a shopping trolley in. So it can be configured to your exact location and your pharmacy register now. That's done. They get a confirmation that the registration is complete, that they're on a priority list, and here's the contact details for the pharmacy. So it'll be your number, your email address, etc. Done. Let's go into our system then and just refresh the screen. We can see that the wait list now has gone to 5 people on the wait list. So let me show you just quickly how we move between the two of these before I go into managing an appointment for a patient. So these 3 lines over here, you just click those and you can see here a thing called appointment types. It's just above the export the CSV file. So click on appointment types and it shows you the different appointment types that we have. So in here, we have 2 set up. One is COVID vaccination 1, and the second, a connected appointment, is COVID vaccination 2. Over here on the right-hand side, we can see, has it been set up to be a wait list, or does it allow a booking, automated scheduled booking, or is it unavailable? So the one I just completed a couple of seconds ago for you was on a wait list. And if you want to change your website to allow bookings automatically, you just press booking and save changes. You will notice that the second appointment is unavailable. That is we don't make that available to the second appointment to the actual patient. That is something that you schedule yourself when they're in the pharmacy, and I'll show you that in a couple of seconds. I'm just going to save those changes, and automatically, if I go back to our site, you will see really quickly when I go through it that they are able to select a time. So those times, that time is there, so that they're the today at 5:10, for example. So now it's an automated booking, scheduled booking, as opposed to a registration on a wait list. The other thing I'll just highlight over here on this appointment types is one of the things we put in for last flu season is that given that the HSE is delivering on a 14-day cycle, we actually put in a capacity. So these are the number of total appointments, both booked and available, that you have available. So and slots that you have available. So in the next 14 days, COVID vaccination 1, 4 appointments are booked and there's 764 appointments available, right? So it becomes you can manage that really easily by changing your calendar. And you change your calendar by going to the specific room, consulting room here, for example. And there are 2 concepts, there's a regular hours and a state specific hours. And let's say you just want to shut down the vaccination and reduce the capacity for Sunday, then you just set it as closed, save changes. For example, that shuts all Sundays. Say you decide that you're not going to do vaccinations on Monday, the 19th of April, then you can set it as closed. And if you want to override the standard hours, you can just override the standard hours either. So very easy. So that's how you manage it. And that's actually how you manage the number of slots that then are available to be viewed by that are available to be booked by the patient. So let me just move on here and just look at the appointments that we have. So I'm going to just run through one that's on a wait list, and I'm going to do the one that I just did a couple of seconds ago. It's this one here, Des Burn 5. So if I view that patient, that person is on a wait list. Our suggested workflow is that you call that patient and assign a time to them. So you will look at the appointment. You can see up here, they're on an AZ1 wait list. It's in green. We can see the client details. So in advance, you can check anything. You can add an email address, or if there's anything incorrect, you can change it there. Same with the PPSN. You can view the consent text. This is the contemporaneous consent that they signed when they booked the appointment. If you need to update anything in advance or when they're there, you can just do that here, and you can just update all of those answers there, and they'll be saved, so you can see them coming in here. Anything that's done is logged in history. If you need to audit anything, there's an audit tool, but everything is available here as to what was changed and who changed it. So in this case, a new appointment was done by Desburn 5, me, on the website, and it was viewed by a pharmacist, Desmond Byrne USB, that's the pharmacist, and then the pharmacist answered some of those questions. So our workflow typically would be assign a time. So you call the patient and you'd ask Desburn 5, when are you available for an appointment? Are you okay to come in tomorrow at 9 a.m.? And you assign the time, done. and there's the time assigned. They've confirmed it verbally to you, and then our workflow kicks in. They get a confirmation within 10 minutes. They also get a -1 day reminder and a -1 hour reminder. That's configurable. And it depends on how you want that set up. There are other tools in here about managing the appointment, like you can add internal notes history, you can send them a specific SMS text if you want to send it to them. For whatever reason, you can reschedule the appointment, you can cancel the appointment. That's all available in there. Probably the most important thing on the day when they arrive in is scheduling the second appointment. So the second appointment is actually scheduled and connected to the first. And we've done that on purpose so that they're not separate, so that you have a complete and continuous workflow between the two. So let me just add a follow-up appointment here. You could press that. You can see I have set this one up for AZ. I've put an 84-day delay in. You can see that in the bottom. The system is suggesting to me to book it on July 3rd. I mean, that elapsed days can be anything. We can set that up as 30 days, 28 days, whatever you want it to be. I just selected 84 for this. So all the pharmacist has to do then is select July 3rd. There's the appointment coming up. There's one available at 9 a.m. Hi, hello, Mary, is that okay? And if yes, then add the follow-up appointment, and you can see it's scheduled. Additionally to that, you can answer, there is the ability to add second set of questions. So there's going to be questions that will need to be answered for the second appointment. I've just put some in here. Did you have any reaction? No. If yes, not applicable. And any medications, no, or whatever it is. And you can just put them in there, and they get saved off when the appointment comes and done. So that's how it works in its the guts of it, if you like. That is how an appointment, the whole appointment system works. And that's how it works for waitlist. The scheduled appointments are exactly the same. Except you just don't need to schedule. You don't need to move a person off a waitlist onto a scheduled appointment. It works exactly the same way. You can see it here. I've already looked at this one. The vaccination was April 10th. I've already scheduled one for July 3rd. We can see all of the details here associated with the patient. We can see the reminder that's gone, the SMS reminder that's gone to the patient there. So that's configured your name, your pharmacy name is there, the date, the time. This is your phone number as well. And you can see that reminder's gone to them today at 9 a.m. by our systems automatically. So one thing just to show before we finish up, and just conscious that I'm a couple of minutes over, apologies for that. I just want to show you one slide because next week we're going to update the software and we're going to add a new feature around prioritization. On the wait list, you will have noticed that there were no prioritization, but we've already finished testing earlier this week the prioritization filter. The prioritization filters are, sorry, excuse me about the sneeze, but P1 to P15. They were defined according to the vaccination groups that the HSE had set out initially. But you can define them whatever way you want. So P1 could be over 60s, P2 could be over 50s, P3 could be over 40s. P10 could be contingency planned. They're able to arrive in the pharmacy within 10 minutes. It's whatever way you want it to be. So you can assign these priorities to people who are on a wait list, and then you can filter those people out in order to aid you as you're going along. So hopefully that is of benefit to you. Thank you for your time. Apologies for running over a few minutes.